Our experts have returned for the wellness panel to offer a little more insight today. Please welcome back registered dietitian, nutritionist Erica Malk, Dr. Christina Brecht of Aesthetic Rejuvenation, and Dr. Adam Rothenberg from Evergreen Health, Orthopedic and Sports Care. Thank you all very much. Erica, let me start with you. You recommend eating until you're 80% full. Okay, color me skeptic that I can figure out when that is. Tell me how to do that.
So that's the key thing, I think, for a lot of people is actually figuring it out. Because especially if we've been paying attention to diets or calorie counting or portion control, we've turned that off. So you really have to kind of rediscover what that is for you. So potentially it's, thinking throughout the day, spending a lot of time in the beginning, thinking how hungry, how full you are. Maybe putting it on a scale of 1 to 10. If the scale is too much, even thinking of it of pleasant, unpleasant, or neutral, for example. And really evaluating maybe halfway through the meal, 3/4 of the way through the meal, how full am I? Am I satisfied? Do I need a little bit more? And a great way that your body will actually let you know if you've eaten enough is if you're hungry again in about 3 to 4 hours. If it's sooner than that, you probably haven't eaten enough. And if it's longer than that, you might have eaten a little bit more than about that 80%.
So you can kind of dial it in doing that. And if we do that, then it sort of staves off the comfort eating, the overeating at the meal just because it tastes good or it's social or whatever.
Potentially. I mean, sometimes that comfort eating and that overeating is actually because we're restricting. And it's because we're not allowing our bodies to have some of those things that are tasty, some of those things that are delicious.
Right. And then we overindulge
Definitely.
at that point. Dr. Brecht, the holidays are coming up, and you mentioned that you do some minimally invasive skin tightening procedures. What does that involve? That people might want to tackle before the holidays?
So, it really kind of depends if you have a certain party or something. The surgical procedures do take, you're smaller immediately after, but there is a recovery period. And the Renuvion and skin tightening treatments can be done. I usually recommend at least a couple weeks before, but your improvement, keeps on improving for months. But then the beautiful little touch-up things that we can do, filler for the mid-face, or a little bit for the lips, or a little Botox, or a little, there are a lot of great things, that we can do to kind of get ourselves lifted.
And give yourself a little time. Don't come in the day or two before with whatever. Okay, so that's a good thing to know. Dr. Rothenberg, we've been talking about knees and hips with you. Let's talk about what patients need to do before they come to surgery, because this is a more involved kind of approach than I realized.
Yeah, just like rejuvenation, patients need the time to recover, and they also need to do things before so that they are ready for surgery or optimized. So I go through these things with patients, but things that they want to do is staying active as much as possible beforehand. Maybe going to physical therapy before to get your muscles as strong and limber as possible. Eating really healthy is very important. Maximizing your nutrition is going to improve your healing. If you're a smoker or use nicotine, you want to stop that, because I'm going to have you do that before surgery so that you have the best chance of healing your wound. And there's a whole host of comprehensive things that we would go through in the visit.
Even going to the dentist and that kind of stuff. Why do we want to get that stuff knocked out?
Well, if you don't see a dentist regularly, you can have infections that may be hiding in your mouth. And if you have an active infection around the time you have surgery, it makes you at a higher risk of having an infection after the surgery or on your implant, because the environment around the hip or knee replacement is susceptible to infections more so than without the replacement. So
that's good to know.
That's one thing that patients sometimes are surprised about. So dental health is important. Whole body health is important. These things don't just happen in isolation.
I wish they did.
Yeah.
That would be nice.
Yeah.
But it's good to know that we need to do those things in general, and we need them before procedures as well. And then one last question, since we talked about the keto and the low carb stuff, where would you suggest people go to get accurate information about what their diet should be like? And I say diet not as in a restriction, but what you eat.
Right. I would say always speak with a registered dietitian nutritionist, because we've been trained, we've had, internships that we've done, over 1,200 hours of that. We've had the education, and we're able to pick through all of those different pieces, all the different fad diets, and use the science to really tell you what's best, but also really what's best for you, because it's not going to be a one-size-fits-all.
I want to do the Blue Zone thing.
Yeah,
I want to do that.
it's
Or
tasty.
move to Sardinia, one or the other. We'll be right back.